Okay, we're on. So I'm Amy Johansen. I'm with Smile Anyway. We are officially 1 year old this month, and we've accomplished a lot. And our next challenge is to create a recovery-friendly community. And I'm willing to take the lead to get us there. And basically, it's being positive, and it's looking at what we have and how can we add to it to enhance it and work together to bring everyone together. I had this idea of a nonprofit after the loss of my son at 24 in 2013. And when I finally decided to do it, it's just growing. And I just go with it. And I just follow my heart. I'm very passionate and very determined. And I have a great board. And we have some members here. And I'm really happy with the size of the group because I wasn't sure anyone would come. So this is fantastic to have you guys here, and I thank you. So what I'm going to do, because I think most of you know me and what I'm about, so I'm not going to take up a lot of time with that. If anyone has questions, especially on the local access cable, they can go to www.smileanywaybranford.org and find out more information. And we have some events coming up this summer, and I'll keep everyone up to date, but this right now is pretty big. So right now, I'm going to hand this over to Pam, because she can explain a little bit more in detail what we're doing. But this is about coming together as a community. One other thing, I'm going to just shoot out a few things. So we had less deaths in 2018, but what we've had is more calls to 911 for individuals to be given Narcan. And I know that number's over 48. So that means first responders saved at least 48 lives in Branford. And that's not including people who have their own Narcan kits at home, maybe used it and brought someone to the emergency. That's just what we know here in Branford. So we have a drug epidemic going on, and it's time to start looking at what we can do to make a difference and save some lives. And that's basically what this program's about, enhancing it and coming together to have more compassion, empathy, and care about our community more. So now, I'm going to hand this microphone over to Pam because we can't be heard on TV unless we're speaking into this. There's also a microphone over there, and I think we're going to go around and introduce ourselves. So I'm going to start with Pam.
Good evening, everyone. Thank you for coming, and then I'll introduce Jason, then we'll go around and see who's in the room. But I'm Pam Lottie. I'm the director of the Alliance for Prevention and Wellness. We're a program of BH Care, and BH Care is our local mental health authority. We have services here in Branford that cover the shoreline. We have services in the Valley area as well. So my program is the Regional Behavioral Health Action Organization. So we cover all 36 towns in the Demas region too. So, and part of my program is to do substance abuse prevention and mental health promotion in the communities that we serve, and we work in partnership with our local communities and our community coalitions. Each community has a local prevention council that we work with. We also work with the other local coalitions. We have Beth here, who is from East Shore Health District, and she runs their opioid coalition through their strategic prevention framework RX grant, working in 4 towns on the shoreline for substance abuse prevention, specifically opioid prevention. So I'm glad you're all here tonight. The purpose and the goal of kicking off the recovery-friendly community tonight is so we can have a community conversation. We've handed out some guidance documents, and our goal tonight is, after we do introductions, to go through the guidance document to see where Branford falls of the services that we have, the services that we don't have, and we already met with the first selectman. And Jamie Cosgrove thinks there's a lot already going on in Branford, and he was excited about this initiative and how we can pull together in the community and see where the gaps are, address those gaps through community partnership resources to make Branford a healthy and safe place to live. and enhance our resources and make sure people in the community aren't hearing that, you know, we've had a lot of saves, but what about when our folks come back from treatment? And what supports are in place? So we're looking to see if Branford could be one of the first recovery-friendly communities on the shoreline. There's several recovery-friendly communities right now in Connecticut. And how this initiative came about was through the Connecticut has a state alcohol and drug policy council that meets regularly, and there is a subcommittee of the council, and Jason will talk a little bit more about that. He's one of the members. And they had this subcommittee that pulled it together and looked at evidence-based practices and models. One of the things that they used as a guidance document in creating this is this Substance Abuse and Mental Health Services Administration. They have the 10 principles of recovery. We have some of those over on the table so you could see what those 10 principles are. And they use that as well as input from their committee members, from communities to say, what would a recovery-friendly community look like and how can we support this and how can we let people and family know that there shouldn't be stigma and shame around substance use disorders, that we can embrace it and we can help support our friends, family, neighbors in our community and make our communities healthy and thriving and promote our successes. So that's a little bit of background of, you know, why we're here today. This is a new movement. We're hoping to roll it out in many more communities. It's part of the work we're doing with the state on the state opioid response grant as well, trying to empower communities to get involved and work together as a coalition on these important initiatives. So I would like to introduce Jason. Go ahead. Hang on.
I'm going to keep doing this. It's going to drive you crazy. One other thing that Smile Anyway is starting is the SMART program. It's you can look it up online, but basically it is going to be for people who have loved ones who are actively using, to give them coping skills and how to get their life kind of back on balance and take care of themselves. There's also a program for adolescents and building self-awareness, self-confidence, in dealing with things like anxiety, peer pressure, you know, substance abuse, suicide, that type of thing. And we are going to be having, we've been asked to have a group in East Haven in the library there, so we're going to be doing that. And we're also going to have a group where parents who have lost someone are going to team up with individuals who have someone active, because I think the two groups can help each other, because they were both they've been through the same thing at some point, and part of healing is helping others. So I just wanted to let you know about that SMART program, and we're going to be getting that information out to everyone shortly. And now I'm going to turn it over to, and not interrupt.
I'm used to being interrupted. It's okay. Hi, everybody. I'm Jason Bannon. I'm an employee assistance professional for a local labor union here in Connecticut. But as was mentioned, I'm on the subcommittee for recovery and health management for the Alcohol and Drug Policy Council for the state of Connecticut. So in Connecticut, there's also other subcommittees on prevention. There's corrections. There's a bunch of different levels of committees that all report back to the Alcohol and Drug Policy Council. So the rubric that you guys have in front of you came out of many meetings. We meet once a month. One of the heads of that committee is Jennifer Chadukowicz from CCAR, and it's also, we have a heavy presence from DEMIS with Lauren Simbab. And you know, through what Pam had said, a lot of this stuff was talked about at great length, and it is really about what do people have as resources when they come back to their community after they receive treatment or just, you know, get sober on their own. So it's also important for me to note that I'm a person that's in long-term recovery myself. So our committee is made up of people, that's one of our charges, is that people on that committee should be in long-term recovery so that we can help facilitate this. So this is your document. Although it was created through our committee, this is your document and whatever it means to you folks. Now, I'm assuming that most everybody here is from Brantford. Is that correct? Okay. Because I graduated one town over in North Brantford. Don't hold that against me. But I have roots in Brantford myself. My grandfather was on the fire department here. My uncle was on the fire department here. My mother grew up in Short Beach. We used to take part in Short Beach days and make floats and do all that other stuff. So I'm happy to be able to present this to you guys here. So I guess what we're going to do is just basically go through this. And if anybody has any questions along the way, please just shoot them out, or I guess you have to pick up a microphone to ask the questions. And we're just going to go through this, and it's really everything that's on here. It's what it means to you. It's not about what it means to me. It's your community. You know, this is just a baseline for a conversation to have, to see what everybody thinks they have, what they do have, and try to coordinate all those resources into one, you know, cohesive unit, if that can happen. There's no right or wrong answers. If you say you're a recovery-friendly community, you are. Some communities want to check all the boxes. Some think that they've done okay so far. It has been rolled out in the last couple of months. There are several towns that are doing really well. There are other towns that are working on it, but everybody seems to be very enthusiastic about having it happen, and I think that's wonderful. I don't know when you want to show.
We're going to do introductions and we'll show that.
Okay, we're going to do introductions, so we're going to pass the microphone off.
And then we have Postit note paper for you to jot things down, and we'll put it on the big sheets of paper as well.
If I'm not mistaken, the camera is here, so everybody should look there.
There's one here, too.
If you want to be on camera.
Yeah, no, it's better for everybody.
And the camera's also in the front.
Okay, but you also have to talk into the mic for them to hear us.
So we'll start here, do introductions, and I'll get this keyed up.
Hello everyone, my name is Taylor Quijano and I'm actually an AmeriCorps Prevention Corps member, serving with Pam at the Alliance for Prevention and Wellness, which is a program of BH Care.
Anna Kaczynski, I'm the Prevention Specialist for Alliance for Prevention and Wellness, which is a program of BH Care and one of the staff that serves Region 2.
I'm Alicia Katz. I'm also an AmeriCorps Prevention Corps member serving with Amy Smile Anyway in Brantford.
I'm Teresa Borchetta, the minister at the Brantford Congregational Church.
I'm Pat Andriel, and I'm on the board of Smile Anyway.
Hi, good evening. I'm Sarah Magistro. I'm the clinical director for BH Care in Brantford, which, as Pam described, is the local mental health authority for the Shoreline area.
I'm Beth Capabianco, public health nurse from East Shore District Health Department, and I'm managing the opioid grant.
I'm Dagmar Ridgway. I'm director of Canoe Center with the town of Brantford.
Good evening. My name is Judith Barron, and I am the director of the community dining room here in Brantford.
I'm Skip Ferry, and I'm the pastor of the Short Beach Union Church in Short Beach. Also serving on the boards of the Volunteer Center and the community dining room.
Hi, I'm Kim DiMiola. I work for the App Foundation, and I've been working in addictions for the last 25 years, and I'm really delighted to be here as a Brantford resident to see what you guys are doing. So, thank you.
Hi, I'm Jerry Katz. I'm retired, so I'm not working for anybody now. Lived in Brantford for 40 years. I'm a parent and grandparent, 3 sons who all went to Brantford High School. All had friends or acquaintances who either died of an overdose or in jail. I now have 3 grandchildren, and my oldest, who's going to be 7 and is in 1st grade, is already starting to ask questions about what's going on, you know, really basic questions about drugs and alcohol. And I saw the listing for this, and I thought it's maybe time to show up and see what's going on. Also, before I retired way back when, I have 20 years experience in the addiction field.
My name is Pat Lee. I'm retired from the Department of Corrections as a drug and alcohol counselor.
I'm Craig Newton. I'm a social worker in town. I've lived here all my life, and the story goes on.
My name is Robin Comey. I'm the state representative for the 102nd District, which is about 80% of Brantford. And I do still serve on the RTM, and I have a lot on my plate.
No. Thank you all for the introductions. So we'll go ahead and get started of looking through our guidance document. If you want to work in small groups, individually, and ask us questions, we're here to facilitate questions. We have Postit Notes. The rubric is broken down into 4 different sections. So you could do a Postit Note per section, and then we're going to hang them up on the walls on the big Postit Note paper. So put down things, let's have a discussion about it. Pass it off to Jason. He's gone through this process before, but before we do that, I just want to show you Danbury's video. It's about 3-4 minutes long. Danbury is one of our first communities who signed on to be a recovery-friendly community, and they worked with their local, bless you, opioid task force to develop this. One of their police officers came up with the video idea, and then they started building their website. They're still early on. It's a work in progress of building their resource page, but it's an actual tab on their website. And their PSA is running, so I'll show that to you for a moment. Then I'll pass it to Jason. Oh, hang on. I forgot I muted my speaker.
No one is immune to opioid addiction. It's your neighbor, your coworker, your friend, your family. I'm here with a few friends to tell you just how serious this issue is.
Stand together.
Stand together.
Make a difference.
Make a difference.
Stand together, make a difference. 1 in 3 families suffers with some kind of addiction. The younger someone begins experimenting with drugs, the more likely they are to have a dependency problem later in life. Prevention is key to helping to avoid addiction. In Danbury, we have a prescription drug drop box at the Danbury Police Department. People can now properly dispose of their unused or unwanted prescription drugs and keep them out of the hands of others. We also participate in National Drug Take Back Days every April and October. We provide education through opioid forums and distribute information to pharmacies, doctors, and through the Danbury Police Department. We also offer presentations to parents and to all 7th and 8th grade students in the middle schools. Please talk to your kids about misuse of painkillers. Keep your prescription drugs out of medicine cabinets and locked away. Don't assume it's not your child, your relative, or your friend. The opioid epidemic is everyone's problem.
Change the script.
Change the script.
Change the script. Redefine what you think about opioid stereotypes. It is all of us.
Every day in the United States, more than 150 people die from an opioid-related overdose. In Connecticut, the typical overdose victim is a non-Hispanic white male between the ages of 30 and 59. 4 out of 5 people who are currently using heroin say they started by abusing prescription drugs. Because of the addictive nature of these medicines, many people with opioid use disorder became dependent by simply following doctors' orders. Misconceptions about the disease of addiction perpetrate a discrimination against people who are suffering with this disease. Shame interferes with people getting the help that they need. It's crucial each of us understand addiction as a disease of the brain and not a moral failing. Be aware of your language and demeanor when speaking about addiction. We say person with a substance use disorder versus substance abuser. Someone is in recovery versus they are clean. Like other devastating social issues of the past, real lasting change will happen through grassroots initiatives. That starts with each one of us shifting our beliefs and behaviors. It's up to us to change the script.
Change the script.
Change.
Change the script.
Change the script. While we know prevention works, recognizing the signs of an overdose can save a life and get the person the help they need.
2 people each day on average die from an opioid-related overdose. It is, in fact, an equal opportunity killer. In the event that someone is overdosing, what to look for, what to do. Pinpoint pupils, individuals' respiratory rate really declines, and eventually their heart stops. So Narcan is essentially an antidote. It's a medication designed to reverse the effects of opioids. Time is critical. This is an emergency, and Narcan is not always effective if too much time goes by without the recognition that there was in fact an opioid overdose. We want early recognition, we want action. Dial 911. If you have the ability to get trained in Narcan administration, do so. If you have the ability to carry Narcan, do so. These particular actions will save a life. They'll give emergency services the opportunity to resuscitate someone and get them to an emergency department where we could save their life and give them an opportunity to recover.
Stand together.
Stand together.
Make a difference.
Make a difference.
Change the script.
Change the script.
It's time to change the script about opioids and take action. We can make a difference. We are making a difference.
Stand together.
Stand together.
Make a difference.
Make a difference.
Change the script.
Change the script.
Please stand together with us and change the script on opioid misuse.
So, again, Danbury's came out of, they had an opioid task force that had been working for several years. The task force saw the recovery-friendly community rubric. They went through it. This was part of, they worked with their coalition on a state targeted response mini grant to develop the PSA, the video, to roll it out. On their website, they have the resources available where people can find treatment options, recovery groups, etc. Like I said, it's its own tab. It's still a work in progress. They're continuously updating it. Their task force is, they have a work group on the task force that's working on it to really promote it. What's rolling out, eventually there'll be recovery-friendly communities with a logo that businesses and places in the community can put on to promote it. They could create signs with the logo, so that's what's in process right now as we're rolling this initiative out throughout the state. So it's really exciting, and I liked showing this in the beginning just to give us food for thought as we go through. And you know, we're here to answer your questions as you go through the rubric with the different pieces. So on the rubric, it'll say yes, not yet, or what the next steps are. We ask you to fill that out. We hope that you've signed in so we can create this and have all the minutes typed up and get it back out to you. And those of you who want to be part of this working group moving steps forward, and how we can, you know, what the group decides tonight, if Brantford is a recovery-friendly community, if we're just not yet there, but we want to be. So that's going to come out tonight as well. So, and I know Amy wanted to say something before we got started.
One thing that we're also working on is Alicia is part of the Prevention Corps. So she is trained to train people on using Narcan. And we're going to be offering more of those Narcan trainings in Brantford. One other thing, I'm also a psychiatric nurse, and I just want to reinforce with people that if you do have a Narcan kit at home and you use it, you always still have to call 911. The half-life of Narcan is not as long as the half-life of an opiate. So you can give a kit, and 45 minutes they could still overdose. They might need 4 or 5 kits. We don't know. So you always have to go and call 911 and have them seen at the hospital. I just wanted to add that. The other thing is, thank you for pointing out the fact that first graders are asking. I think that's really important, that we have to acknowledge the very young to the very old. I think there's every age. I dislike it when someone says, oh, he's a good kid, you don't have to worry. They're all good kids, we're all good people, we all have to worry. And that's really what this is about, is coming together and taking care of our community. So I'm going to let you guys start working on this.
What questions do you have for us? Sir? I'm sorry, I jumped in on you.
It's okay. Does anybody have any questions so far? No? Okay.
I have one regarding funding to get things done. You know, working for the town and trying to become a recovery-friendly community, how did Danbury get money to fund the work that they're doing?
So that's a great question. That's a great question. Most of the work that Danbury's doing was through volunteers on a task force. They did create the video, from my understanding, with some of their mini grant dollars that came through the state to their local coalitions, which your local prevention council or your local community coalition can apply for, which are small mini grants of up to $5,000. And on those mini grants, there were specific pieces that they needed to accomplish. So they needed to accomplish a lot of what you saw in the video, where they have to do education out to the medical providers. They have to talk about doing safe storage and disposal, whether that's installing a drop box, working on getting a drop box, buying the deterra bags to bring to elderly living units. Not assisted living, but, you know, like elderly housing and disabled housing, or for community members getting lock boxes for people who may have high risk. Also using part of the Change the Script, which is the statewide campaign. There's multiple components to the Change the Script campaign. So there's the community component of Change the Script, and then there's a Change the Script campaign specifically for providers. It's Change the Script RX, and that's through the Department of Consumer Protection, and that's specifically aimed at our medical community. So there was a lot of different initiatives going on. I know Beth here in town through East Shore Health District, they have one of the mini grants, as well as the SPIF RX, and she's been doing a lot of education out in the community. Also part of that was to do Narcan training and disseminate Narcan to our high-risk populations once they've been trained. So we held one of those last spring at the health district, and we had a really great turnout of folks there. So there were 7 different deliverables that were part of those mini grants, but you already had to have a local prevention council, which all of Connecticut cities and towns do have, working on it, or a local coalition. So
one of the things with this rubric was that it shouldn't have to cost any money that wasn't already there, whether it be through a grant or a volunteer or what have you. Because as we all know, when everything gets tight, right? So when we go through this, you'll see, and really this was to be a conversation starter for towns and local government and, you know, prevention councils and RBHAOs and all of that. So I don't know how you want to do it, if you want to do it in mini groups or whatever, because yeah, it's really up to you guys.
Do you want to work in groups? Yes, Craig? Do you want to mic? Wait.
Yeah.
For the viewers, as well as the people here, it might make sense that we get a little closer and we work together, making comments instead of breaking up, and that those comments get heard, people's ideas. This is very complicated, so the more people in the group, the better, maybe. There's probably a couple people that could fill this out immediately, knowing what the services are, so it's more about where do we go from here. Does that make sense?
That was my idea in the first place. No. I think we have to move our tables together because we need to come together as a community and discuss this. So maybe if we take these chairs, bring them over here, and then people in the back, we can make room, and or we're going to have one microphone on one side, another microphone over there. And this is grassroots stuff, but you know what? I'm up for the challenge. So
That would be everybody.
that's it. Well, we could actually put 2 tables, bring another table over and make more room if we want. You want to just push that table ahead?
That's okay. We're not worried about it.
No, I just, but I have to make sure my kids get better.
If you just put microphones down there, hopefully you can get this up.
Robin is on the RTM.
That's why I mentioned it.
It's just a disappointment that we don't have anybody from the RTM other than Robin, who's also with the state government. I think that they have to get involved.
They were invited. Flyers were sent out everywhere. Do we have anyone from the rec department? They were invited too. Senior, we have Dagmar over here. Thank you, Dagmar. School system. I did, okay, and I did talk to...
Everybody who's supposed to be here is here. Okay, that's all I'm going to say about that. Everybody who's supposed to be here is here. If anybody's not here, this doesn't have to end here. This is a living document, right? It can go wherever it needs to go. It can be talked about with whoever it needs to be talked about. This is just to spur a conversation and have us go over what may already exist, what may be able to be created, and how can we coordinate all those efforts and have the maximum effect and help the communities that we're serving. Yeah, Craig.
Suggestion, would it make sense that we start at the top and just go through and say yes, not yet? Yeah. I mean,
that's what we're gonna do. That's what we're gonna do.
And that's what the Postit Notes are for, so if there's not yet, or you want to write down services that you know, please put them on the Postit Note, and I'm gonna go put the big sheets up, and we'll put those up afterwards. Let's go through the rubric first.
So who knows if the mayor is interested?
Okay, so where's the microphone for you? If you're going to talk about it.
So the first one is the mayor, town council, and/or board of directors is in agreement with developing a recovery-friendly community.
Want to take a vote?
I want to have on the other microphone.
It's up here.
Pam and I both met with Jamie Cosgrove, our first selectman. He was very supportive, and that's all I can really say.
So we don't know yet.
I think he is. I think there's not been anything formal. I'm pretty sure he is. He's my boss. He is on board. I think there's not been a formal proclamation or any kind of thing through the Board of Selectmen. I don't know what needs to be done on that, but I do know you have the support of the first selectman. I would say yes.
But that's the person. This is the mayor, the town council, and or the board of directors. It's not stating one person. So I'm not talking just about Jamie Cosgrove, but there is no one else here, officials representing the town.
So the next step, instead of answering yes or no, is to obtain the support.
Yeah. Formal. I would say not yet. That would be my.
So she's saying,
So we need that.
Lexi's saying that because they're not here, it's a not yet. Because we're trying to get formal. We're trying to get there. So if we were there, everyone would be here, right? So, or someone representing. So I think, that's, you could be, that's how she interprets it. So you guys have to interpret it on your own or as a group.
Yeah, so one of the things I will say to that is, I understand what you're saying, it may be a not yet. Just because they're here doesn't necessarily mean that they're not in agreement of wanting it.
But I wouldn't say it's an actual person.
Okay, yeah, no, that's fine.
I do think to get some kind of formal thing, you have to present them with something. And Amy did go meet with them and felt that he wants to move it forward. Okay, but all I'm saying is this group would then have to develop a plan and present it to have it be moved forward, I think.
And we can certainly, as the subcommittee, reach out to those folks and have a presentation with them and sit in their office. Because I've done this with just a mayor, not a group as big as this. And in Waterbury, I met with the head of the police department and the fire department and
that was
those
done.
folks.
Then you're the perfect guy to chair who deals with the city of Brantford.
Okay, so we're moving on to B. Thanks, Craig. I appreciate it. I've known Craig for a while, so we can talk like that. All right.
But that would be reasonable to have a group of people who are responsible to liaison this group with all those people in the Brantford Town Hall who would seem to want to be involved and how to be involved and how they can be supportive. Pat, you're a veteran of all this. What do you think?
Yes, I do think so. I know that Jamie is supportive of this, Dagmar, but I think that we need to get the RTM involved, we need to get the Board of Finance involved. All town government has to be behind this.
Are you interested in that?
And that would be wonderful.
I'm interested. I was there.
1, 2, 3. We got 3 so far.
So we've been,
Thanks for volunteering to take notes, Craig.
and Craig, you're on.
No, they need help, whatever.
You are.
I have interest in other areas.
Oh, they're gonna grow.
Okay, so would it be fair to say next steps is to reach out to the local officials and we can do that?
Well,
Okay.
I think when you're talking about a recovery-friendly community, that means everyone in the community gets together.
And I agree with you, but as far as the rubric goes, on letter A, it's what it is.
It is what it is.
And I'm wholeheartedly in agreement with you that it's
Right.
recovery-friendly community, and I agree with that.
This is the first step.
Sometimes it would make sense to go to them and say, would you be willing to appoint somebody to be the liaison? So instead of us
We're
going
going
to
to get
them
there,
all
it's
the
in the
time.
rubric. Thank you, Greg.
We're gonna get there.
It's called a recovery champion. Okay?
Where are you, Jason?
So now we're on B. The mayor, the town council, and/or board of directors has appointed a recovery champion. The champion is a person who is committed to supporting recovery from substance use conditions and who is willing and empowered to lead the town citywide efforts necessary for becoming recovery friendly by convening department heads, other leaders, including faith leaders, youth and persons in recovery on a monthly basis to develop and monitor the community enhancements outlined in this document. The RC Planning Group.
Volunteer for that position?
I volunteer.
Second? All in favor?
So I guess that's a yes.
Congratulations.
I was planning on it. C.
The city-town has a local prevention council, and if so, this council is integral to the mission of the recovery champion.
Excuse me, yes, we do have, it's through the Brantford Counseling Center.
Is there a drug abuse committee?
Yes, there's a little prevention council.
There is the open panel committee. I'm on that. Michelle is.
Point of history, a long time ago, Pat, you probably remember this. We had a young man who, by the name of Bartholomew, and I bet this was like 69, 70, who was killed on the highway, and everybody got together and said, we need a drug abuse council. And John Sliney, I think, appointed a number of people. You were too young to do it then, but Bruce Grennan and a number of other people served on that committee, and that became the impetus of getting Brian Lynch into the cellar of the Congregational Church, and it all began. Here we are again. Okay, so it was formed. Tom Bracken, Brian Lynch, and they formed the hotline, and that's where I began. Hi, Tom.
Okay, so there is a local prevention council? I have no idea. Is there anyone here?
What was
from
the
local
question?
Prevention council?
There's a local prevention council. Peter Cimino runs that through Branford Counseling. And at the health department, we have a COPE committee that meets quarterly. And I go to I am a member of a bunch of different councils. And so we have that, but at the health department, we're the 3 districts.
Mhm.
And so we get together with everybody from Branford, East Haven, North Branford, Northford, to talk about all the different initiatives that we're doing in the three towns. So there are initiatives in the town.
Great.
And I'm on both of those committees.
And the local prevention council through the counseling center receives money from the state. Where are you, Pam?
I'm here.
Yeah, isn't that correct?
That's correct. So the local prevention council, they get pass-through dollars, and they have been funded for.
So the local, I'm going to give this to Pam.
So as I mentioned earlier, each community has a local prevention council made up of citizens from a variety of different backgrounds, and they do get pass-through dollars, and it's population-based dollars. It's very small amounts of money, but the few $1,000s that they get, they do make it go a long way, and they do various initiatives that fall under the 7 strategies for communities for change. So they're evidence-based strategies of things that they can do to make a difference in the community. Yeah, they do a lot of partnership work with other groups because it's a small amount of money, so it's seed money to get really the initiatives going and for them to partner with other agencies, other programs, and again, it's community work. It's your grassroots to do prevention efforts and population-based prevention.
So Smile Anyway is a non-profit grassroots, and 50,000 might seem small, but to a group like Smile Anyway, who doesn't get anything, that's a lot of money.
It's like $5,000.
Yeah, it's more like 5,000.
Whatever it is. Yeah. It's not nearly that much money.
So everybody knows now that there are 6 or 7 groups in this town, all working to do something about the addiction problem. A little money here, a little money there. Is there a way that, as of tonight, we could have somebody sit down and write the name of the organization, what they do, and how they do it? And that way we would have a list of the 8 or 9 Branford community support services that are available. Individual, group, meetings, prevention, treatment, and so on. It would be very helpful, I would think.
That's what the Postit Notes are for, so if you have those, please write it down in Postit Notes.
Postit Notes.
On the big sheets over there, but we need to keep going with our rubric.
I'll give these to Craig. Your Post-it notes.
We have lots of Postit
We have-
Notes, so just write stuff down as we go through.
Okay, so D. The town website reflects that it is a recovery-friendly community. Not yet. Okay.
So the general consensus is no.
Not yet.
Not yet.
And again, if you know resources that should be there, jot them down on your Post-it note, and we'll stick them on the big Post-its and start taking that inventory. We have a pretty good inventory from the group work from the other groups that have been done. But if something sparks as we're going through this, just please jot it down before you leave. We'll put it on the big piece of paper.
Well, I know that myself and Beth have an appointment coming up, and we're combining resources. Beth is always combining and sharing, as is Smile anyway. Gotta get those.
Okay, so we're going to go on to municipal department buy-in. So the Parks and Recreation Department hosts recovery-friendly activities and events. I see a lot of no's. I see a lot of shaking heads and no's. Not yet? Okay.
None known.
And once again, this is what it means to you guys, not, you know what I mean? So if it's, the recovery-friendly activities could really be anything. Softball,
I mean, I know that there's.
golf tournaments, it could be anything. Go ahead.
I just wanted to ask you, does that include things that serve liquor or no?
No.
All right.
Although, now that my mind is working a little better right now, it could possibly, it's really what is up to you. I mean, would you consider an event that serves alcohol recovery friendly?
There could be a recovery-friendly activity where there was a recovery ambassador present. Just throwing something out there.
So I would say at this point, we're going to say not yet though, right?
What about just the facility itself? There's a lot of space, I'm sorry, there's a lot of space at the rec department and people may use that space. I don't know if they have NARAA meetings or when it opens, we make that part of it. So we could say that maybe, we're not sure.
My understanding is that a lot of the churches have closed their doors to 12-step meetings. I'm not sure the reason for that, but that's what I've heard.
So my understanding too, under recovery-friendly activities, is advertising things that you might already have in place. So, for example, some communities do family game nights or trivia nights or different events like that, or they might have a sober softball league, a sober bowling league, and you advertise leagues or different events that you already have as being alcohol and drug-free to encourage your recovery-friendly community to engage in that. Those are some other examples that other communities have done. I don't know, Jason, do you want to add anything or?
To the recovery events?
Yeah.
I mean, it could be dances, it could be all the things that Pam had said. Any event basically that doesn't have alcohol or drugs at it, realistically.
It could even be a sober softball team participating in the regular town league.
Okay.
Being part of the community.
The schools offer substance use and problem gambling education, alternative peer groups, family support for identified substance use problems, student recovery groups, recovery promotion, and anti-stigma activities, etc.
So I would ask if we have any parents who have school-age children in the Branford school system.
Okay.
I think that's a service that is offered to families within the school systems if those issues arise, and I think that they utilize referral-based systems as well, and that we have those services should we need to seek them out in the schools.
I see someone shaking their head differently.
they can do better. I had a son who's in recovery, and when he was in high school and stuff, I really got no help.
You work in high school?
Mm-hmm. Middle school, middle school, forget it. Middle school, forget it. And that's where it started, was in middle school. And I've asked if we could start in the grammar schools because they need to be aware of drugs and bad things. Just the person talking to them, taking a Tic Tac, saying this could be a pill that someone took, and you could get we need to do it at their level and go into middle school. They do, once a year. They put something on at the high school. But yeah, I'm on that committee. They want to do it more towards middle school based, but it needs to be in elementary school, and it also needs to be in the high school. All the schools.
Yeah, I think we have to put that down as not yet. I think they do different things in different places, and I think the schools do offer substance abuse and problem gambling education in the high school, but certainly not family support, student recovery groups, recovery promotion. That's not there.
I know the high school has to put in the curriculum to address drug abuse and stuff like that. In the gym or a health class. It's a health class. Yes, she does.
You know, just to say, you know, on their behalf, they really do try, because I know that I've met with Jen, and she does meet with them in smaller groups. And I do, you know, not just, I know they have a big assembly every year for, I think it's the 9th graders, if I could be wrong. But she meets with all the groups. They do try to do a lot of prevention strategies. So I have to say that as far as prevention and awareness, they actually are doing more. I was surprised at how much they were doing, but I do agree that there's not really a place for recovery groups and family support. I know that they do have the school-based health, and school-based health, I've met with Melanie. I know she's they're aware. They just are looking for avenues, and they are trying. We have another event that's coming up soon. We're trying to work with parents in the PTO. So, or PTO, PTA, depends. But they are trying. It's just a matter of, they're just not there yet.
Can I ask a favor? You know, this is being aired. Can we please refrain from using names?
Yes.
This is supposed to be a community discussion, but it is being aired, and I just want to be mindful and respectful of people who are not in the room, and, you know, keep things, again, let's just have the conversation and keep it general, please.
Yeah. In the 70s, I know the state, this federal and state money that came in, I was head of a program in the Lower Naugatuck Valley. Sorry, I'm getting recovered from a bad cold. And there's a lot of money going for prevention life skill programs in the elementary schools, in the middle schools. Is that going on in Brantford now? Does anybody know? You know, strong prevention for life skills, not just how to say no, but how to make good decisions, dealing with bullying. Is that happening?
I think that's a question that, you know, under the not yet, we could find out what evidence-based curriculums they're using, because I know many of our school systems do use evidence-based curriculums for their health classes. It's part of the state mandates. I can't speak to, you know, what every school district's using in our region, so that's a question that we could write down and ask them. Yeah, write it on a sticky note or write it on our grid. But all right, so we're done with schools. We're moving on to the next one.
Yeah. Okay, so police and fire department personnel encourage treatment and other recovery approaches and are knowledgeable about local resources. If there's no one really from the police department or fire department here, I don't think we can honestly answer that. It would be all speculation.
just as somebody that gets called by the police and by the fire department, they do contact our crisis services at BH Care if they are with somebody and concerned about their mental health or substance use. So I don't know if that happens at every call, but we do get called out if they are concerned about somebody, and they do try to connect them to resources, and they do seem pretty knowledgeable about what we do, or if we need to contact them about something, they seem aware as well.
And I would add to that, the whole town of Branford Fire and Emergency and Dispatch all have also gone through training for mental health and substance use disorders. So they're very engaged and involved, and they do have those resources available. Just, I know they're not with us tonight, but I do know from the work that we've done with them.
I do want to just say that when we say not yet, we are not meaning it in any kind of negative way. We don't mean to be negative. So it's not yes or no, it's yes or not yet. So in no way have I meant to be negative at all. As far as the police and fire, I can tell you that in my line of work, I cross paths with them all of the time, and they are very receptive, very supportive. I can text them at many of them, any time of day or night about things to deal with recovery or things like that, and they are very responsive. So kudos to them, I just have to say. I think they're very supportive.
I agree with you too, and we had the documentary Do No Harm, the opiate epidemic. If any of you have Amazon Prime, please watch it. It's very informative. And I found the same thing. We had a member from the fire department, and he was very, very, they do care. And I've had more than one EMT come up to me, and just the very caring people, very empathetic.
Is there a needle exchange program, any of the departments, health department, or anybody have? No?
Not that I'm aware of. I think maybe some of the pharmacies might. I'm not sure.
New Haven, you have to go to New Haven to.
Why don't we have a drop box in Branford? Yeah. Why don't we have one? Guilford has one. I think it should be in every town.
Yeah.
Tax dollars.
There are
think
a
it's
host
important,
of towns
yeah.
that do have them, and it's listed on the state's website as to where the medical drop boxes are. There is a bill as well. Go ahead.
So it's also on our website. There's a variety of drop boxes in Region 2. Guilford is one of the closest to us, and there's also a bill right now before the legislator to have them be able to have them placed in pharmacies. Some other states have that. We don't have that right now. Ours is only police departments, and every state police barracks also has one. I know there's been take-back days as well that happen twice a year, which are very beneficial. And I know Beth has been doing a lot of work with getting lock boxes out and the disposable bags as well. Yeah.
That's one thing you can do, is you can take the meds, put hot water, kitty litter, coffee grounds, shake it up, just throw it in the trash, don't flush it down the toilet.
So I know one of the biggest setbacks for setting up drop boxes in each town is that it's taxpayer funded. It costs a lot of money to not only secure it, but then to transport it. It has to be transported with police to they usually incinerate it. Now I know in New York they did just pass legislation in the entire state where the pharmaceutical companies are responsible for funding. And I think it's definitely worth writing your state representatives, letting them know that statewide, but to spread that out as an option, that it was something that was successfully passed in New York, and I think would solve a lot of the issues with it being so readily available in each specific town. If the pharmaceutical companies are setting these drugs out, then they should be responsible for disposing them, not us.
I just wanted to point out here, it says police and fire department. I believe strongly we should list separately emergency services, meaning the medical services. So it's police, fire, and EMS, 3 groups that work very hard to save the people that get called because they're down. They're the ones that are actually giving out the Narcan. They're the ones that are putting themselves in jeopardy when they go near the medication, possible fentanyl exposures and so on. So it's a threesome, not just fire and police.
Okay. I think in Branford we are, the fire. I think in Branford the fire and the EMTs are the same. They have to be duly.
They're all duly
licensed, trained.
I am well aware of that, but I would list them separately.
He's saying he's aware of that, but he'd like them listed separately. So I think that's a sticky note.
Okay. The Human Resources Department, nope. Nope. The Social Services and Health Departments are well-versed in treatment and recovery options that reflect multiple pathways of recovery. That's next.
Not yet.
It's next. It's the next one, Craig. Stop moving ahead. Are we saying that?
I don't, Kim, what do you think?
Oh, you said yes?
I think not yet, but that's
yes.
me. What do you think?
In town, I don't know the services, so I can't answer that.
We'll put that on a sticky note.
So,
I'm sorry, the social services and health departments, not you, with the health department.
Well, the health department wouldn't be providing recovery
right
to people. We are very much aware of who we can refer people to if we do get the call, but that's not something that we're going to be providing to people.
So it's social services, basically, who might step in. That would be through, I believe, the counseling center. Am I wrong, Pat?
all it's saying is that they're well-versed in treatment, not that they're actually going to send them to treatment.
I would say not yet. From personal.
And that reflect multiple pathways to recovery. There's not just one pathway to recovery. People recover in many different ways. Some are faith-based, some are 12-step based, some, you know, yoga, meditation, however it is. There are many pathways to recovery. So.
Right.
Question.
Maybe we should separate social services and health department. I agree, because health department, right. Social services is who you call. Social services is the number you call when you're homeless and all that.
If you would like to separate it on yours for your town, go right ahead. This is a draft for us, and when you guys tell me stuff like that, I will bring it back to the committee, and it may change, or we may, you know, talk to other towns and cities about that. But if you guys want to separate it on your own, it's totally fine. Yes, absolutely.
I think as we're talking about these services, maybe a second meeting, because a lot of us don't know because we've never investigated it. So perhaps each of us takes a section, investigates it, and then reports back.
I love it. That's what this is a conversation to do that, and that's exactly what we need.
So one of the other things, to your point as well, is with a video or something, or if it's on the town website and there's a resources tab, all that stuff can be drilled down and have resources for different things. And that's a great way to add to the conversation. Just spinning around. Okay. All right. The Human Resources Department includes addiction and recovery awareness training as part of their new staff orientation and offers EAP services.
Everyone knows what EAP is.
Okay,
The town does offer EAP services. I am not, employee assistance programs. We do participate in that. And I'm not sure with the new HR director how they're managing new orientation for new employees. That would be a question for HR.
So for the viewing audience, and anybody who doesn't know what EAP is, it's Employee Assistance Professionals Programs for employees, for everything, basically, from financial problems to substance abuse and everything in between. Short-term counseling, assessment, and referral for those problems.
F?
Oh, F? Okay, great. The city town welcomes safe and stable recovery housing.
Not yet.
Wow, that was a resounding not yet. Okay. Okay.
G.
There are community centers for youth and adults. Yes, there are here.
Well, it's being built.
It means whatever it means to you, Greg. Okay. Listen,
So what's the question in that? Like,
what's that?
the question for youth and adults, so they do have youth programs and adult programs, yes.
Okay.
Maybe not geared towards recovery, but they do have those programs.
This is just our community centers for youth and adults.
Yeah.
Okay. So moving on to community attitudes. Businesses are open to hiring people in recovery and advertise same.
Not yet.
Okay. No words of wisdom, huh? Mm-hmm. She said there are businesses that will hire folks, local franchises, but it's probably not public knowledge.
I work for BH Care's vocational department, and I work with Department of Mental Health and Addiction based clients who are referred to us. And I can honestly tell you, we ask if they want to disclose or not. 90% of our clients don't want to disclose, and if we go out job developing, we never wear our badges, we don't give our cards out, because I would say maybe 20% of the time, they'll accept us in there if they know where we're from, and if they ask us, we have to be honest and tell them where we're from. They're like, oh, no thank you, we're not hiring. So we have a few people who we can place, and some local businesses, mostly mom and pop places, that if they have someone in their family, then they're more than willing to give our clients a chance. But the majority of the time, our clients don't want to disclose, and they don't want us even going in with them, because they don't want to be stigmatized.
That's it, stigma.
So, they can easily give another reason for not hiring them. They say, oh, they don't have the background, oh, they don't have enough experience. And we know exactly what it is because they were willing to meet with them right up until they found out. Because they'll say, oh, well, I have a vote counselor, can you contact them if there's a problem? And they're like, oh, you know what, it's not going to work out.
So I think that would be a not yet. B.
Community organizations are open to providing volunteer opportunities to people in recovery. Some are?
I would say not yet, because I'd like to see more organizations opening to volunteering, or having volunteers.
So what could be next steps for that?
Craig has a word.
So speaking to the people that aren't here, it would be a wonderful time for businesses and local organizations to offer their employees to counsel people who may need help with their resumes so they can get a job, counsel the young kids about what to wear, and so on. And anybody that has any ideas about ways to support people who are recovering from addiction, we are, as a group, open to that. Now, if they want to get in touch with us right now, how do they do that? They can send an email.
They can send an email to me at amyjohansen@smileanyway.branford.org. But I think we were on community organizations are open to providing volunteer opportunities.
So I do want to just back up one,
Sorry.
because with the businesses are open to hiring people, it was discussed before that eventually there's going to be some kind of logo, an RFC logo we're working on. It's probably going to be the state of Connecticut with RFC on it as recovery-friendly community. And at some point, businesses that are willing to hire could put that little sticker in their window, and people who know, and people who don't won't.
And maybe there can be a reward
Right.
system for having that sticker.
If I remember our EAP statistics properly, every organization has approximately 15% of their employee base that has been or is involved in some form of substance abuse or addiction treatment. So this is not like bringing new people to the workforce. There are many people involved, many people that need support, and because we know that addiction is a lifetime process, it goes on and on, even if you're in recovery. So in the life of an employee, the chances are that they will be involved with substance somewhere along the line in the course of 20 years working for somebody, and they need to deal with that. You might want to comment on that as an EAP professional.
I'm not here as an EAP.
Never mind.
All right.
But
So
thanks for asking.
I'm going to bring us back to our organizations providing opportunity for people who are in recovery to volunteer. Okay, so we're not sure, so we're going to say not yet.
They just want volunteers, so are they saying, like, they're not, you know what I mean? Like, people aren't qualifying that they want certain kinds of volunteers, they just want volunteers, so. Do you know what I mean? Right.
As a person in recovery when you go to volunteer.
Right.
So I guess this would be like if there was a special program, like a sober house, and they said, okay, this person needs to volunteer but has to leave for meetings, would that organization still welcome them?
But we can't say not yet because we don't know of anyone who has gotten discriminated against for a volunteering opportunity.
So maybe we're there.
We don't know.
We don't know. So maybe not yet with a question mark. You know what I mean?
Okay, well, you could
All right.
ruminate on it. That's okay.
Thank you.
Or you could tie that one to the, is there
How about the
recovery events?
How about the next, we could tie it into this one.
The community supports formerly incarcerated individuals. Want to speak on it? You don't have to.
Okay, but people, I think, are,
Okay.
they background checks. I'm going to hand this down to this side of the table. They have a lot to say.
Pat, you probably, from your experience at Branford Counseling Center, have seen people who have just gotten out of jail and need some basic needs assessment and to have social service issues taken care of, insurance, some of the basic things that even if it's a homeless person. So I would assume if we were to understand who comes to the Branford Counseling Center, there would be a small percentage of people who come out of jail and need that help, and that's the service they provide. So I would say if the counseling center does it, we have it. Whether they use it or not, that's another story, but that's BH Care probably has a percentage of people who come out. The state is now sending a lot of money out for that kind of thing.
Absolutely. We have people all the time that are coming to us for the first time after getting out of being incarcerated, and unfortunately we have active clients that become incarcerated and come back to us. So we do whatever we can to provide counseling and the wraparound services they need to make them successful in the community. There are barriers. Employment, I know, is a big one. Yep, housing is another big one. If they have, depending on what their record is, it's hard to get them in different places, but we try to work with them still. We don't say, oh, we're not going to be able to find you a job or housing because of your record. No, we're going to try to do it. They're much harder to come by, and I think it really depends on what your record is, too. I mean, we've had people say with an arson record, it's going to be really, really hard to house them, whereas somebody that maybe had, a charge not related to something like that might be a little easier. It really depends. And, some landlords do a background check, some don't. So I think that our staff gets really skilled at knowing who they can refer who to. So
I think it's important to paint these questions with a little broader brush. It doesn't say every person in the community supports individuals who've been incarcerated, Right.
Like on any application, if you have to put dates of employment in, and they'll say you have to explain any gaps. So they can either lie and say I was taking care of a sick relative, but at the minute they look up a background check,
Right.
It's on there. So we always refer, if we're having a hard time, depending on what the charge is, we're part of the Greater New Haven Employers Network, and we go there once a month, meet with people around New Haven and West Haven and East Haven up this way. And there's 2 representatives that are there from the Second Chance. And we can refer right to them, and they have a list of employers that they'll even sometimes give us who will hire people with records, again, depending on the record. They're not going to put somebody in a store who has grand larceny.
Right.
So
Yeah, depends on the felony. So community resources. Residents know how and where to obtain Narcan.
I see a hand.
Just stepping back real quick, a lot of people are coming out of jail now on Suboxone and other medications. Is there somebody here that could speak to the follow-up in our community for those individuals who have to get the continuing support services that they got when they were incarcerated, now that they are on the medications?
I can speak on that. I did work in corrections. People were detoxed on Suboxone. They were not maintained on it. They did have the methadone program, and if they were able to get into the methadone program while incarcerated, they would follow up with a referral to the App Foundation.
Or they get sent back to their home clinics. APT, Regional Network of Programs, they work with different jail systems, and they are expanding those programs. They've been highly successful. So they are working on that.
So bring it to Branford, so we have a place to get methadone and a place to get follow-up services in our community. Sure. As I was saying, wouldn't it be nice if
I'm sure
Branford
we'd be
had
happy to open a methadone clinic in Branford. We have 2 in New Haven, 1 in North Haven, and 1 in West Haven.
Well,
so those are close, but find us a building.
Well,
I'll bring it to my boss.
the problem is getting transportation to the methadone and back, and we probably have a lot of our people at SCRC and ADAPT and some of the others, and they go into New Haven, which is not, that's a long drive when you're in Branford, every morning. So, anyway.
Isn't BH Care opening a new?
So BH Care actually does have a medication-assisted treatment program. We don't prescribe methadone. That's a different license that we don't have, but we are able to prescribe Suboxone, or it's known as buprenorphine also. So that is something that people in this area can come to our clinic and get, so they don't have to go into New Haven. If they have Husky insurance, the state insurance, they can get medical transportation to the clinic, so that makes it a little easier for them to come get it. We also do some other treatments like Vivitrol, so there are other options besides Suboxone and methadone that people can get, and we offer all the wraparound services as well, counseling, other psychiatric medications. Here's our brochures.
Okay. We're going to go back. Residents know how and where to obtain Narcan.
I'm going to say not yet.
There is a website, unfortunately, I don't remember it off the top of my head, that you can search and see all of the pharmacies and pharmacists in the area that do prescribe Narcan and where you can get Narcan. I think maybe that resource should be available on the town website if we're going to tie it back into what the town website offers.
Yeah.
At the health department, we're working on a website now that's going to bring people to all these different areas, like where can you get the Narcan, what is Narcan, redirect to the state now. At a state level, the state is working on a big program, an initiative, so that people can go on that website and learn what is Narcan, how to use it. And so our goal is to have people be able to visit our website and then be linked back into other programs that are out there.
On a personal note, I feel that I should have an Narcan kit because of what I'm doing with Smile Anyway. And I've been trying to get a Narcan kit, and I can't get one.
I could put a Narcan kit in your hand tonight.
Thank you. I have some pull.
The state does have a
Very easy to
website. It's on the
get,
DEMIS website, ct.gov DEMIS. It's right, if you click on the opioids, it lists all the pharmacies where it's available. Also, 211 promotes every community Narcan training that is going on. So, like I mentioned, we've had one at the health district that was at capacity. You know, so they are happening on a regular basis. There's going to be more coming to the town of Branford, but that is something that is available, that is out there. It's just, do we know if people are accessing the resources?
Yeah, could I say something? Most of you with agencies, different agencies in Branford, as a parent, my son or one of their friends overdoses, I call 911. I'm not going to go on a website or try to, probably not going to have a Narcan kit available, unless they're a long time using it, I'm really aware of it. Most parents, I think, are going to call 911. Probably, yeah.
We have programs. We're running programs, and I know that we ran one at the senior center, and we had a pretty good showing there. And while we were there were people that had adult children living with them that had substance use disorder, and they were wanting to obtain Narcan kits and learn how to use them. So then if their children were home, their adult children were home with their friends, and somebody ran into a problem, they were prepared. And so I think that it's just a matter of having the programs. The programs, I'm finding that the programs are out there. It's just getting people to come to them. It's almost like people seem to wait until there's a problem before they decide to come to the programs. So I do think there's a lot of initiatives out there. It's, again, and they're being advertised. It's just getting, some people don't want to go to programs that are in there. What I found is people don't want to come from within town to the program. They're more apt to go drive 4 or 5 towns over to go to a program to get a Narcan kit than risk having somebody see them trying to get a Narcan kit in their town.
Just one more point. Also, I think if you have an elderly person living with you who is using prescription medications, you need a Narcan kit too, in case they can't read the directions and take too much or get confused. So it's not just stigma-based, but it's also, we need to protect everyone.
So I just wanted to add to, when we induct somebody on Suboxone, which means put it on them on it for the first time, we do ask them to bring a support person with them, and then while they're getting inducted, that support person is trained on how to administer Narcan and is also given a prescription for it that they're able to obtain. And we do offer prescriptions for Narcan for family members or clients with known opiate use disorder so that they have the opportunity to get it as well.
And just from the RBHAO standpoint, obviously we have a contract with the Department of Mental Health and Addiction Services, and to date we've given out and distributed through education, going out to our communities, doing the education and working with folks. We've distributed more than 372 kits out to people who have a loved one that has an opioid use disorder, and that's not including all of the folks who've come to trainings and and have received a kit from the mobile pharmacist. Because when we were going through and doing many of the Narcan trainings, many times we would have a mobile pharmacist who was running it through people's insurance, because we do have a limited number of kits and they have to go to, you know, our priority populations for people who need them. So that has been going on, it's continuing to go on, and as I mentioned, they're always advertised through social media, through 211, and through different websites. So Narcan is covered through insurance. There's several different types. The nasal Narcan is the most popular, and it varies on what your copay is and what your insurance plan is. But and most pharmacies, I know a lot of our big chain pharmacies have trained the majority of their pharmacists, if not all of them. Certain chains have all of their pharmacists. So if you walk in, they can prescribe it. Most of them have a stock of it, and if they don't, they can get it to you within 24 hours.
And a lot of trainings that happen are free, and they do give out, yes, they do give out kits. So we're going to say yes, not yet, or next steps on residents know how and where to obtain Narcan.
Yeah, it's kind of your...
Okay, hospital emergency departments have recovery coaches available. There's not really a hospital in Branford, so
right.
That's kind of a NA, right? Not applicable. Okay, faith-based resources are recovery informed and easily accessible. No. I'm kidding.
The emergency room is not a place to send somebody who decides, the emergency room is not necessarily a place to send somebody who decides that they want to get help and go into detox and then treatment. Emergency room, if you are in there and you have the need, there are incredible people there who will help you. There's a program. There's also social work. There's also a direct link with SCRC, which is a detox area. But Branford, hopefully at some point, will have a number that can be called when you have somebody sitting in front of you that says they want help, that will help counsel the individual, search out the insurance, search out the beds, and follow up with the individual with the support of a family member or somebody else. The emergency room is a crazy place.
I think the recovery coach program that they're speaking of in this is, you know, often they've paired up throughout the state with recovery coaches. So when someone overdoses, is brought into the hospital from an overdose, they'll ask that person if they would like to speak to a recovery coach. You know, I feel a lot more people feel more comfortable speaking to a recovery coach than a doctor that they just met for the first time. And they've found these programs to be very successful. You know, oftentimes these recovery coaches are just people in the community who are in recovery themselves, are very, you know, interested and active in recovery, and can point them to resources and help them and essentially coach them through their recovery. But it is effective, you know, when these people, they're not, I don't think often going to the emergency room to get treatment, but when somebody goes in for an overdose, you know, to have that support there afterwards, when they, if that's what they want, you know, sometimes that can be a big wake-up call to people.
I think it depends also how busy they are. Sometimes they're released within 25 minutes, but it would be really nice if we had a recovery coach system in Branford, so because there is a small window when someone is willing to get help, and if we could jump in and get someone over there, that would be fantastic. So what are we saying? Not yet?
Faith-based resources are recovery informed and easily accessible.
So I'm going to ask my friend Teresa.
I can't speak for all churches. I don't believe we are, and I'm at the Congregational Church. Maybe other churches are. I just don't want to speak for them. Maybe, you know, I don't know. Yeah, yeah. So we are not. No.
I did talk to someone who is very involved in Branford, he's away and couldn't make this meeting, who's very interested in helping and is involved in recovery with individuals. So I don't want to say his name, but there is someone in Branford that I'm aware of, and we'll be in touch.
Okay. I do know that there are multiple 12-step meetings in Branford on a daily basis, in churches, held in churches. Whether that means they're informed or not, they are easily accessible. I would say that.
I would say that there's also a lot of 12-step for AA, but not enough NA.
Yeah.
Well, a lot of churches have also aren't having some of their meetings anymore, I think. All right.
Okay, moving on. Residents know how to access peer support and mutual aid groups and are aware of other pathways of recovery.
I would say not yet. Owing because I know that the activities, events we've had, we bring in all sorts to educate. Because everyone's different, everyone has a different method.
Are there any parent groups in Branford? Be loosely? Parent support groups?
Yeah,
okay.
Right.
There's no NAMI groups I'm aware of. Are there any NAMI? I think it's a pretty
So do you think that residents of Branford know how to access those peer support groups
No.
and mutual aid groups?
No, that would be, I think, a really good resource tab on the website.
Letter E, local transportation is available to individuals seeking treatment or a support group.
Not yet.
No transportation?
I think we heard before that depending if you have certain insurance, you get medical coverage for transportation.
But that's for medical, not to go to a support group. But you have to give 24-hour or 36 hours notice, right?
Stand up at a meeting and say you need a ride. You get a ride.
So, all right, so I'm hearing that individuals seeking may be able to get rides.
But if you are not at that place to stand up and get a ride, and you don't have insurance that would cover the My Ride,
Be eligible to live within 3/4 of a mile of a fixed route, but there are some resources, not 100%, but there are.
So where are we putting down for,
I think not yet, but if we need to improve,
I'm hearing down here, I'm make sure everyone has an equal voice.
do we want to say not yet, but we need to take steps so that it's more, we can put a tab that has a phone number you could call and someone will help you get a ride.
Does BH Care give out bus passes?
The bus pass won't get you to a church for a meeting that's 3 miles out of the way off the main route, though. Not if it's, I would say not yet, and we could take steps to improve.
All right. Residents know how and where to access treatment and other recovery resources, including recovery coaches in the community.
Not yet.
Residents know how to access telephone recovery support.
Wouldn't that be 211?
Can be, but not everyone is familiar with 211.
Not yet.
Physicians that prescribe medication for substance use disorders are easily identified and available.
It's very difficult to find a doctor that will take Husky D or anything like that in Branford unless you're an established patient. I don't know if BH Care would help with that.
We take all insurances pretty much. There's very, very few that that we're not on their panel for. But yeah.
I think not enough of the town knows about it.
So what are we saying on that?
I think we need to promote it more. Not yet.
Okay, so I will say that all these not yets that you have on community resources, if you have a web page, can all be, can be yeses. That's all. It's okay. Family education and support groups are available.
Not yet. I will hope to change that.
Food, clothing, and other basic supports are readily available. Okay, I do know that to be. So once again, I will say that this is a rough draft. This was a conversation to be had about all this and maybe raise awareness to things that can be promoted, are already here, can work together. People can go out into the community and make those things happen. I hope you guys meet again for that. And if you wanted the support of anyone on our committee, we would certainly be more than happy to come back and talk to you guys more. If you need any help with any of that stuff, we would be more than happy to help in any way that we can to facilitate any of that stuff.
I got your number.
Go ahead, we have a question down there. Go ahead, just one of your names. Our names? Yeah, so we don't have all the names.
You don't need
I'll put my contact up on the board with Jamie's. Yeah, with Jason, so.
I think that I would just like to say kudos to BH Cares and to the health department because overwhelmingly they support people and the population. I think overwhelmingly though on this, the community as a whole outside of BH Cares, which there are so many people who are not your clients, the answers are not yet. So the community as a large is not yet, but kudos to those that are making a difference.
There's a lot of communities out there that don't believe that there's a problem either. I'm not saying that's specific to Branford. I don't know that that's happening. But in the state and in the country, bless you, there's a lot of, it's not here. And the numbers say differently. There's been over 1,000 opiate overdoses last year, but alcohol as well, and other synthetic drugs, synthetic marijuana, all sorts of different stuff is contributing to all of this. I know we oftentimes talk specifically about opiates because we're in the middle of this crisis with it, but alcohol still kills more people every year than that does.
The other thing is Connecticut is rated, I believe, number 11 for having a drug epidemic. So that's, almost within the top 10%, number 11. That's pretty significant, and I know it's in our community, and I hope we can work together and make some changes and shake things up.
You guys have done an amazing job tonight, and I think for the viewing public here, don't underestimate this cable and getting out into the community. And before we close, I think it would be very important that you give out your email again, and so we have somebody that can receive the calls from people who view this. We do not have an opiate crisis, we have an addiction crisis, and that's where we include the alcohol, the drugs, and everything else that goes along that list that's getting longer by the day. I think everybody here, it's like talking to the people who are already involved and already care. The people who are watching need to be involved as they can or will be. Addiction is a lifetime problem for some people, many more people than we would like to consider in Branford, but Branford will survive and do a very good job if we do it as a community. We take care of our own, and you guys deserve a tremendous amount of credit, and your energy is amazing. So what is your email?
So everything's up there.
Amy, A-M-Y, Johansen, Johanson, at smileanyway.branford.org. The website is www.smileanyway.branford.org. Their number is 203-864-4346. Never hesitate to call.
Should we pass the phone to Branford Counseling Center and their phone number, and BH Care and their phone number, and APT and their phone number, and anybody else wants to give their phone number out? Or, well, that's easy, but we got the people here. Pat, tell us.
Wants to put it up there, put it up on the board.
I know, what's the Counseling Center phone number? 481-4248. BH Care?
203-483-2630. We have 24/7 crisis support, so all you would need to do is follow the prompts on how to be connected.
And the Branford Counseling Center has an answering service, so you can call it any time of the day and night. There's always a clinician on call.
Okay, the App Foundation is 203-781-4600. You can also access our website at appfoundation.org. It talks about our walk-in hours for admission.
I was at the West Haven App Foundation. It's a beautiful facility, and the different services they have are incredible. So I was very impressed when I went to a conference there. Thank you. Thank you, everyone, for coming.
Yeah. So just a reminder, just to wrap up, I have the sheets there. If you have Postit Notes to go on there, we have your contact information. We'll be reaching out to you if something pops into your brain at 2 a.m. We could connect you to local groups that are meeting. We could, use this as a work group to move this based on your interest, your thought, your input. We will reach out to you. We are going to have someone work on all of the minutes from tonight and pull it together, and we will share that with you and make it this living, breathing document for the town to see, where we want to go with it. But this is just our first informational session to understand and build awareness around the recovery-friendly community.
How is the viewers getting the minutes?
We will find a way to get everyone the information needed.
They could reach out, they could email me at pmautte@bhcare.org. It's PMAUTTE@bhcare.org. They could email and just say, I watched it on TV, I'm interested. They could email Amy as well.
They can do whatever they like.
Yeah, and the town website, and we'll talk to see if we could get something going on the town website.
Yeah, I think meeting with Beth, and we're going to pull together our resource numbers and websites, and we'll get those to Jamie and hopefully get those on. But really, thank you everyone for coming. I think this was a great meeting. I think, we have to throw out those ideas and have conversations. And if we work together, we're going to make a difference together. So thank you.
Thank you, everyone. Safe travel.